Hi everyone, my name is Bailey Conrad, and my partner Kathleen Keating and I are going to be talking about the over-the-counter medication coenzyme Q10, or as we'll be referring to as CoQ. So the therapeutic roles of CoQ is it helps generate energy, or ATP, or adenosine triphosphate, through the electron transport chain, which I'll go over in the next slide. Also serves as an antioxidant and protect it from oxidative damage. And then since it is present in the electron transport chain, which helps generate energy, it's mainly found in those organs with the largest need for energy, which is the heart, kidney, and liver, and especially the lungs, since a lot of oxygen flow goes through them. And then also CoQ, just generally the levels decrease with age and also from various environmental and genetic factors. So here's the physiology of the electron transport chain, which is located in the mitochondrial matrix. So you can see the phospholipid bilayer of the mitochondria, and each component, there's component 1, 2, 3, 4, and they move electrons throughout the chain. And so you can see coenzyme Q is located right above component 2 of the electron transport chain, and it moves electrons from components 1 and 2 to 3. And so this electron movement causes protons, the hydrogen ions, to be pumped from the matrix, which is shown in the bottom of the image, to the intermembrane space at the top of the image. And so those hydrogens, which is not seen in this image, are later pumped back through the matrix through a rotor, which makes adenosine triphosphate, or the ATP energy that we mentioned. So if you follow the arrows from 1 to 2, 3, 4, those are the arrows of the electrons, and you can see the hydrogens being pumped through the various components. And so that was a lot of information. So just to recap, what is CoQ's role in the electron transport chain? Does it produce electrons? Is it an electron carrier, or is it a proton carrier? If you said electron carrier, you are correct, because remember, it takes them from components 1 and 2 to 3 to continuously go down that chain. So just as a reminder, CoQ, it does produce energy, and it is an antioxidant. So when treating all these disease states, it assists with that. So with heart failure, and there's low ATP levels and increased oxidative damage. And fertility, sperm and eggs, and skin is also very susceptible to oxidative damage. And then it also has shown a role in decreasing headaches because there's abnormal mitochondrial function associated with headaches. It also can help exercise performance via decreasing oxidative stress. Can help with diabetes, actually, because oxidative stress can influence diabetes, and then abnormal mitochondrial function is linked to insulin resistance. Oxidative stress is very characteristic of cancer, so it helps with that. The brain is also susceptible to oxidative damage, as well as the lungs, like I mentioned, since there's a lot of oxygen flow throughout them. So it helps prevent that oxygen damage. And one of the biggest uses for it is with heart failure. And so this study was done to show the effects of CoQ on heart failure. And so they tested the use of CoQ versus placebo groups, and they found that less reached a long-term endpoint, which is just severe implications from the heart failure. So fewer reached that point, fewer had mortality from the heart failure, and then fewer had hospital stays that were on the CoQ compared to those that were on the placebo or no medication at all. And so just another recap, can CoQ treat diabetes, true or false? If you said false, you are correct, and that's because it doesn't treat it, it's just known to potentially assist, and it's shown a correlation. And then here's just a list of some non-drug alternatives which can be found in the diet. So I included a picture of salmon, which is a really popular one because it is a fatty fish, and it's also delicious in my opinion.
All right, so there are some adverse effects associated with CoQ, and these include nausea, vomiting, diarrhea, and in some patients, loss of appetite. And these have not been widely studied, but doses of 100 milligrams per day have been associated with mild insomnia for some patients, and elevation of liver enzymes has been reported in some patients that take over 300 milligrams per day, but luckily no liver toxicity has been reported. And CoQ toxicity is very unlikely even in patients that take up to 1,200 milligrams per day. And patients with kidney or liver disease should not use CoQ due to the lack of research in this area. It has just not been studied, and therefore it is not recommended that patients with kidney or liver disease take CoQ. And there's also very little data on how CoQ interacts with chemotherapeutic drugs, so it is not recommended to take CoQ if you are also taking chemo drugs. And because CoQ can lower fasting blood glucose levels in some patients, patients with diabetes or those patients that are prone to hypoglycemic episodes should be cautious when using CoQ. And CoQ should also not be used by nursing mothers, children, or infants, just because there's a lack of research in how CoQ can affect these populations. And another quiz question, so true or false, those with diabetes should be cautious about taking CoQ. This is true. So you said true, you are correct. Diabetes or CoQ can be helpful for those who have diabetes, but there is a fine balance between taking too much CoQ because it can put those with diabetes at risk for low blood glucose levels.